Hello, I'm Dr. Prahlad Prabhudesai. I'm consultant pulmonary physician practicing in Mumbai at Lilavati Hospital. And today, for a few minutes, I'm going to talk about the aspect of treatment, that is pulmonary rehabilitation in management of chronic respiratory disease. This is an important component of management, but a lot of people are aware about it, but they are unable to practice because many reasons. So let us see how, first of all, the rehabilitation is important. All our patients like chronic bronchitis, emphysema, if you see interstitial lung disease, they are chronically hypoxic or they have breathlessness as a main important manifestation, and with the medicines, whatever available, there is limitation in treating the pathophysiology which is happening inside the body. Like in obstructive airway disease like COPD, there is a limitation of even including the triple drug therapy, which is currently being a very important therapy. There is a limitation as well as the breathlessness is concerned. And as you know that patients would like to do everything in their life, they would like to have a quality of life, and the level of quality of life, patient's ambition improves significantly, or that's increased, you can say, when you treat them better and better. So rehabilitation is really important on that aspect of the management of COPD, where you can make the patient breathe better, do well, they to do activities, they can, whatever their goals are there in the mind, we can achieve them, realistic goal we can achieve them. So this is how basically the rehabilitation is a part of treatment in COPD. Similarly, in interstitial lung disease, there are limitations of treatment. Like for example, steroids, will have limitations. It will have more side effects on muscles and bones. Then the drug like antifibrotics, there are again limitations that they will be able to slow down the process, but they cannot cure. Finally, what happens? Patients' breathlessness leads to decreasing their physical activity. That affects the muscles, the quality of muscles, the requirement of muscles, oxygen requirement of muscles being changed. The muscle fibers level, the functioning of the muscle fibers significantly decrease or get altered. What we call as an, instead of aerobic respiration in the muscle, it goes into anaerobic respiration in the muscle. Especially in COPD, when the air is trapped inside, the hyperinflation happens, the respiratory muscles like diaphragm, the intercostal muscles, they are under stretch and patients feel breathless. On top of that, if there is secretions inside the lung, in both in COPD and ILD, again the oxygenation gets affected and patients also get a poor quality of life. Rehabilitation improves the muscle strength, that's very important. Their quality of muscle fibers, they become a better muscle fibers, consuming a lesser amount of oxygen and giving better outcome by exercise rehabilitation. So that also affects the human mind, the patient's mind. And then they feel better and better. So obviously their visits to the doctors goes down, their hospitalization to some extent decrease. Third important thing, if they get hospitalized, they recover very fast and they come home very fast. Most important thing is that, as I said, that their day-to-day activity improves and their quality of life also improves. So rehabilitation should be included, and there are various components of rehabilitation. So we should have center-based rehabilitation, hospital-based, or we can have the web-based program, and these are all places where we can have rehab. But all these rehabilitation will have certain components. There is one important component is chest physicians, who are involved in this, should motivate the rehabilitation to the patient. Then the other component is basically education, assessment, assessment by the chest physiotherapist as well as by the chest physician as well as the respiratory physiotherapist. Then most important, physiotherapist, who is going to give the muscle training. Then nutrition is very important. Who is going to modify the nutrition? Psychologist, okay, who is going to assist the respiratory nurse, and occupational therapies, etc., which are the other people who can help you to conduct a good rehabilitation, so that the patients will come to the either in the center or the hospital or in the web-based program, and they do frequent these activities, physical activities under supervision of physiotherapists, where they will be given, whenever required, oxygen or whatever it is, but the muscle activity will be gradually increased. Generally 3 times or 4 times in a week they are carried out, and timing is around 45 minutes, and the whole program is individualized by the physiotherapist to that patient, whatever his requirement as per that. So this is an important thing. The results are good in both COPD and ILD. Results are good both in home-based program, that is web-based program, as well as on the in-clinic, based program. So overall results are good in this patient. They also socially, they will better, and their socialization is there. They also emotionally problems are solved, and in the rehab centers and when they are with the physiotherapists. So overall, their adherence to the medical therapy, it becomes better. Next important aspect, you also understood that yoga pranayam is our therapy, which is there for years. Okay, people are aware of that. We now trying to amalgamate yoga and pranayam into regular rehabilitation program, which will give us a better results. Our experience is this, okay, that pranayam, yoga, meditation take care of the mind of the patient, take care of the vagal activity of the patient, reducing the heart rate, cooling down the blood pressure, reducing the blood pressure, and overall this patient's stress level, mindset of changes, and they can fight the disease as well as their whatever their status is there much better than if you do not involve the yoga and pranayam. They have limitations in the management of these patients, COPD, ILD, as well as the rehab is concerned. Not only that, the rehabilitation is very important for a transplant. Before and after we should do. We also use that for major, supramajor surgeries on the thoracic spine, esophagus, aneurysms, and kyphoscoliosis, etc., and pectus excavatum surgery. So there are very select group of patients need a good rehab before and after for a faster recovery from the surgery and their effects. So cost-effective point of view, okay, after the vaccination, smoking cessation, most important thing is pulmonary rehab. Then comes the all other medication, dual bronchodilators, triple bronchodilators, etc. is if you see the pyramid of COPD management. So rehabilitation is, we have to follow as per the GOLD guidelines and ATS guidelines, including the weight-based program. If your patients are not able to go to a clinic or a hospital, it also give a good significant outcome, obviously with some limitations. Okay, thank you very much.